Hello. So my name is Shade Gabuyo, and I decided to do the topic on the individuals with disabilities for my case study project. The the patient's name that I did it on from the case study was Mr. Patrick Lake. Date of birth is 01/12/1986. 64 years of old male, no known allergies, and I see that a height was not mentioned. To my knowledge, that I looked through the chart, but a weight of 280 pounds. So the reason behind the video was to basically see where I would see this patient in 3 months after nursing interventions and evaluations that I have put down since he's left the hospital. So my first diagnosis that I put that was I felt significant. My nursing diagnosis is decreased cardiac output related to generalized weakness, as evidenced by unable to no longer participate fully in ADLs prior to this admission. You can tell by his signs and symptoms that he could no longer have the energy to do what he needed to do. He was fluid overloaded. He had fine crackles in his lungs. So of course, what they did was give Lasix to take some of the fluid off, and I think he put it about 1,000 milliliters out. So with these patients, you want them on a low sodium diet because sodium attracts water back in, which brings them back to being fluid overloaded. So I thought that was one of the important things. So I felt that 3 months later, I hope that he would stick to a 2 gram or a low sodium diet, watching what he eats, and be able to maximize his capacity on what he can do with his ADLs. Another important thing that I saw was powerlessness related to his chronic illnesses and recent hospitalizations, as evidenced by the multiple recent admissions, hypertension, the AKA, CHF, and AFib. My desired outcome that I put was the patient will display increased ability to manage self. I would assess for feelings of apathy, hopelessness, and depression. Assess the role of illness that plays in the patient's sense of powerlessness. Evaluate the results of the information given on the patient's feelings and behavior. Evaluation, I put that I feel like this patient needs psychiatric therapy to help deal with his emotions, and he'll be able to voice issues and be able to feel like he has some type of control over what he may be experiencing. I know when he was talking, he did feel like that he felt that he was a burden to his family, and the fact that his illnesses was getting worse, and he would have to ask more of his family. That to me was a sense of powerlessness. I also listened to the wife's recording as well, and she also talked about how she doesn't know if she'll be able to continue to advance to help him, and then she feels like that she would have to bring in her kids in to help as well. Also related to having that amputation, along with the fatigue that he's having and the decrease in strength and how much he can do on his own, I feel like this would be a good resource to add in OT and PT, and in about 3 months, like him be at his best ability to do his ADLs. Another nursing diagnosis that I put was situational low self-esteem related to loss of body parts and change in functional abilities, as evidenced by perceiving change in usual patterns of responsibility and physical capacity to resume his role. My desired outcome was that the client will be able to recognize and incorporate changes into self-concept in an accurate manner without negating self-esteem. As a nurse, I would consider the patient's preparation for and view of his amputation, even though that he had it years ago. Did he get the right psychiatric evaluation after? I know that he could have PTSD, anything in like that area. Also, I feel that as a resource that we should also add in a counseling group or some type of support group where other amputees or also any other people that have been in the military and have that type of experience that he has, that they can get together and talk about what they've been through, how they're surviving in the world, how they're doing things. And I feel that that can create some type of bond or relationship between people that's had the same instances as him. And I feel like that would benefit a person, especially if they're not negative about the whole situation, or they feel like they can relate, but the fact of like finding help in these support groups and just building each other up would be where I would see him at. So functioning to the best of his abilities, going to support groups that deal with amputations after the military, things like that. Yeah. And this concludes my recording for the case study.